striking anti-choice restrictions on women's health care from this bill. 6 weeks ago, millions of women took to the streets and marched in communities across the country, hand in hand with their husbands, brothers, and fathers, to send a clear signal to President Trump and members of Congress. Hear our voices, respect our bodies, protect our rights. But House Republicans clearly did not get that message. Their idea of a health care plan is a bill that's riddled with dangerous attacks that undermine women's safety and their constitutional right to choose. And I want to be clear, again, despite what my colleagues say, the law is clear. Federal funds cannot be used for abortion services. That's the law. That has been the law. But this bill defunds Planned Parenthood, a trusted safety net provider that provides vital care to 2.5 million Americans. This bill eliminates women's access to no-cost birth control, to mammograms and cervical cancer screenings, and increases women's out-of-pocket costs like co-pays and deductibles. It also creates sweeping new restrictions on abortion coverage for women who purchase health care insurance using their own money. It's unacceptable. Experts have even predicted that these restrictions could cause insurance companies to drop women's health options in their plans altogether, including those offered through an employer or purchased without the help of tax credits. What's worse, there are no meaningful exceptions to protect a woman's health. And I want to repeat, the restrictions in this bill have no meaningful exceptions to ensure women's safety isn't put at risk. That means women like Stephanie from my district, who faced heartbreaking complications from her wanted pregnancy, would be left without coverage for the doctor-recommended care that she needs. That is irresponsible. We shouldn't be injecting ideology into women's personal medical decisions. Mr. Chairman, there's so much else this committee could be doing to help women and families. We could be expanding access to child care, cutting taxes on the middle class, or bringing down the cost of prescription drugs. Instead, we're going out of our way to attack women's health. It's an insult to the millions of women who marched in January and made their voices heard. I urge my colleagues to support this amendment, and I yield back.